Good afternoon and welcome to our daily media briefing. Tomorrow is Friday and we'll be taking some big steps in our effort to gradually reclaim our local economy and putting our lives back into order. Following the governor's guidance and using input we received from the business community, we developed a business safety framework that lays out the basic criteria we would ask businesses to adhere to as they put together their safe reopening plans. As the governor has mentioned, some retail businesses will be able to open as soon as tomorrow. Those retail businesses include bookstores, clothing stores, shoe stores, florists, and sporting goods stores. Let me reemphasize that when they do open, we are only talking about allowing curbside pickups and not allowing customers inside the store just yet. All reopened businesses must prepare and post a safe reopening plan for each of their facilities in the county. The form is available on our county coronavirus website, which is coronavirus-sd.com. The governor has also has a COVID-19 general checklist for retail employers, which will be attached to that form, and you should make sure you comply with that also. The safe reopening plan will need to be posted near the entrance of the respective facility and should be easily visible by the public and by employees. A copy of the safe reopening plan must also be provided to all employees performing work at that facility or location. All reopened businesses shall implement the safe reopening plan and provide evidence of its implementation to any authority of enforcing this ordinance and this order upon demand. Any business that fails to comply with the safe reopening plan may be required to close. But our goal here is to help businesses and get them to comply. We don't want to resort to enforcement, so let's all work together. Even if your business doesn't reopen this weekend, we would encourage you to fill out that form so that you are ready. Businesses won't need to submit their plan to us, but if you have questions, we have a team standing by. There is an email address on our website, which is COVID-19 business questions at sdcounty.ca.gov. And now, let me introduce Supervisor Fletcher to go over the charts and the numbers.
Thank you, Supervisor Cox. Before we get to the numbers, I want to walk through in a little more detail the governor's announcement today. We know that this is a very challenging time where you have information from a lot of different sources that are all coming to you at one time, and you have a lot of overlapping jurisdictions, and it is a situation that lends itself to confusion. And so I want to try and provide just a little bit of clarity and a little bit of framework for where we are in San Diego County today in terms of what we can do from the state of California and what we cannot do as a region. As was mentioned, effective tomorrow, retail entities like bookstores, jewelry stores, clothing stores, shoe stores, home and furnishing stores, sporting goods stores, antique stores, music stores, and florists, those entities are allowed to open tomorrow for delivery and curbside pickup only. It is also allowable for manufacturing facilities, warehouse facilities, and logistics facilities that support these retail entities. They may also open effective tomorrow. Each of these businesses that open needs to go to the county website and download our safe reopening plan, complete that plan, and post it along with providing that plan to your employees. Now, in addition to the plan that you need to post, attached to the bottom of that plan is a checklist that came from the state of California and for the governor. This checklist will guide you and assist you in filling out your safe reopening plan. You do not need to post this plan. You only need to post the safe reopening plan. So again, if you are a retail business that is in the category that I just outlined, and you can do delivery or curbside pickup, or you are a manufacturing, warehouse, or logistics company that supports those retail entities, you are free to open effective tomorrow, contingent upon completing our county safe reopening plan. At the bottom of the safe reopening plan, you will see a checklist from the governor you can use as a guide to help you complete it But we're trying to make this as simple as possible. We don't want you to have to go to 2 places and download 2 different things. So the only thing that you need to complete is the county's safe reopening plan. You will see at the bottom of that a general checklist from the state of California that you should use as a guide. But again, fill out the safe reopening plan, post it, send it to your employees, and you are free to open in those entities as soon as you do that, as soon as tomorrow morning. Now, the state also outlined that there are additional companies and additional entities that are in stage 2 that they believe that will be coming soon, but not tomorrow. Those are things like offices with physical distancing, seated dining at restaurants, shopping malls, outdoor museums. Those are, they said, coming soon, but not here effective tomorrow. So effective tomorrow is just those retail entities I outlined: manufacturing, logistics, warehouse. Download our safe reopening plan, fill it out, you can open. There will be additional companies, entities that will be available per additional state guidance. Now, there is a mechanism in the state plan where counties can move swifter than this if they meet certain criteria. Unfortunately, San Diego County does not and will not in the foreseeable future meet that criteria to move faster than the state of California is allowing. And so at this point in San Diego County, we're going to move consistent with the governor's guidance. So we hope that that provides a framework and some direction about what we need to do, what we can do, what we can't do, and where we are. We should expect regular updates from the state of California, and as we get those updates, we'll digest what it means for us here in San Diego County. We will share that with you, and then we will all move forward through this difficult and challenging time together. As it relates to childcare, which is a vitally important part of any ability to reopen our society, you cannot effectively reopen jobs if schools are closed and there's no places for kids to go during the day. We have been working with a number of childcare providers in terms of looking at how it is we can get more of them up and running and online and available to be in a position to reopen. We are making some modest adjustments to our child care provisions in our public health order. We are simply going, right now the limit was 10 kids, we're going to 12. We simply want to align and be consistent with the state of California. We are clarifying that in child care facilities, the mask requirement does not apply in that controlled child care setting. It is simply not feasible or practical. And we have amended our hygiene standards to make clear that things like bathrooms or contact surfaces can be utilized by multiple groups of 12, provided that there's regular cleaning in between those, and you will see those in our public health orders. Again, they're generally modest changes to our child care order, but they are designed to make it a little bit easier to open and comply. We've been working with a number of child care providers, in particular the YMCA of San Diego County, which I know has an interest in figuring out how they can get their summer child care programs up and running to be a resource to parents as we begin to go back to work, and our efforts will continue. I've been in conversations with our schools and superintendents about what they're imagining when they get the go-ahead from the state of California. We'll be talking to them more next week. Been in conversations with a variety of child care providers about what they need in order to be able to get up and running. Those conversations will certainly continue next week, but we are aware that in order to open our economy, we have to simultaneously work with those child care providers to make sure that safe environments for kids that are adhering to what we think are the best practices that are available, understanding the constraints of child care settings are in place and that they are allowed to open and move forward. And so our efforts to try and provide more child care opportunities, get those open and online, will continue, and we believe that we will see progress this week, over the weekend, and into next week in order to make more of those available. Now we'll jump into our update today. Significant jump in testing today. We had a number of entities that did not report over the last few days, but today we're reporting 3,325 tests that were done. We're reporting those today. Brings us to 69,062 total. A few more contact tracers, 163. To be clear, we have an initial goal of 450. That is an initial goal. That is an organizing goal that we are using. We are in the onboarding, backgrounding, training, hiring process as we speak, and we expect to see the 163 number continue to increase. We also expect that the number we have as a goal could change and go up in the future as we continue to get additional guidance and input. 5,396 investigations performed to date. We presently have 188 individuals utilizing our public health motel rooms. This is the third T of the test, trace, and treat for 588 cumulative individuals involved in that. Today we're reporting 110 new positive case results for COVID-19. Again, this is out of a substantially large number of tests today, 3,325. And again, today's testing, the asterisk there reflects we got some batches of tests that were not shared the last few days. They all came in one day, but that has us at a very low 3% of total tests came back positive. Drops our average there quite a bit. In terms of hospital capacity, we're presently at 134 COVID-related patients in our area ICUs. Total hospitalizations for COVID, both ICU and non-ICU, presently stands at 379. And then you will see that 379 that are hospitalized here on the next chart in the context of the total hospital bed utilization at 3,840. Again, the orange representing the COVID, the turquoise color there representing non-COVID, and then you see an additional uptick in current bed capacity with more hospitals reporting their available beds. Last one here is just our cumulative totals. You see the total number of positives for our region to date, 4,429. Estimated recovery there at almost 2,500. Hospitalizations cumulative, the doubling rate of 31 days. ICUs cumulative, along with the doubling rate of ICUs at every 37 days. And so again, we will continue to provide guidance on what entities are open, but just to reiterate and recap, those retail entities that can do curbside and delivery, consistent with the categories we outlined, along with warehouse, manufacturing, and logistics associated with those entities, are free and clear to open tomorrow, provided you have completed the county's safe reopening plan, which is located on our website. At the bottom of our plan is a checklist from the state of California that can help guide you through things that you need to think about. But completing the county plan and posting that is the only thing you need to do. We will await further guidance from the state about other entities and sectors that can open. They said coming soon, but not immediately. And then the last piece, again, to reiterate, because this is the part that will cause confusion, there is a provision that allows counties, if they meet certain metrics, to go beyond what is allowable right now. But those include essentially 0 deaths in the last 2 weeks from COVID and a number of other things that no large urban counties in California will be able to meet. That does not stop us from moving forward with the retail. That does not stop us from moving forward with the warehouse and the logistics. It just stops us from moving beyond what the state of California has outlined. So we know there will be questions. Again, as Supervisor Cox outlined, there is an email on the county site for questions about business reopening. We want to try and provide as much information as clearly as possible with what we know at the time, and we will continue to strive to answer questions and provide that information. With that, I'd like to turn it over to Dr. Wilma Wooten for a Public Health Officer's report.
Thank you, Supervisor Fletcher, and good afternoon, everyone. As usual, the statistics for cases and deaths today includes the global, national, and state statistics based on data from the Johns Hopkins dashboard shown here, and this was obtained today at about 11 a.m. These data are as follows. Globally, there are over 3.8 million positive cases, including 266,000 deaths. Nationwide, the United States is reporting over 1.2 million positive cases, which includes 74,000 deaths. Statewide, over 60,000 positive cases, including 2,464 deaths, have been reported. And today, the County of San Diego is reporting 4,429 cases, which is 110 more cases than yesterday, as well as 165 deaths, which is 7 more than reported yesterday. Now, of the total 4,429 cases, again, the demographics has not changed. Age range 3 months to 10 years of age. 51% are represented by the age group 20 to 49 years of age. 49% of our total number are female, 51% are male, and 904, or 20% of the total number of cases reported today, have been hospitalized. And of the hospitalized number, 287 have been admitted to the ICU. This ICU number, 287, is 7% of the total number of cases and 32% of the number of cases that have been hospitalized. The 165 deaths report represents approximately 4% of the total number of cases. Now, of the 7 additional deaths that are being reported today, the age range is 57 to 88 years of age. 2 are female and 5 were males. Our sincerest sympathy and condolences go out to the family and friends of those lost to COVID-19, both reported today and during this entire pandemic. As this slide, the next slide notes, there have been 69,062 tests performed regionally, which includes 3,326 for the Tuesday, May 6th. This is includes testing that was done several days before, but the numbers are increased for that day. Now, please visit our website so that you can get these data provided in numerous formats, including zip code, race, and ethnicity for both the cases as well as the deaths. Regarding outbreaks in congregate and community settings, today we are reporting a cumulative total of 61 confirmed active outbreaks. We have 3 new outbreaks. 2 are in congregate facilities, or rather 1 is in congregate facilities, and 2 are in the community settings. For congregate facilities, there are a total of 39, which includes 1,035 cases and 85 deaths. For the community setting locations, we have 22 active outbreaks, and this includes 2 new outbreaks reported today, and cumulatively there are 186 cases and 5 deaths. Lastly, we have obtained several questions about dental services, so we wanted to provide you an update regarding this issue. The California Department of Public Health will update current guidance regarding the prioritization and delivery of non-urgent services, including previously canceled or postponed patients, preventive services, dental procedures, and routine dental services. And it is anticipated that the guidance for these non-urgent services will be provided very soon. And lastly, our metrics are currently trending in the right direction. This is due to the efforts from all of you, our San Diego residents, our organizations, businesses, and governments. So we thank you for all that you do. Now please welcome back to the podium Supervisor Cox. Thank you.
Thank you, Dr. Wooten. We're going to go directly to the questions. Again, as we call up your call, make sure if you're not introduced by your name and your outlet that you do so before you ask your question. We'll go to the first call.
Marilee Moore with Fox 5. Please state your question.
Yes, Marilyn Moore from Fox 5 News. As you mentioned earlier, we have all that criteria from Governor Newsom to be able to reopen and go faster into it. And as you mentioned, phase 2, San Diego won't be able to move further along than the governor's guidelines. But you mentioned specifically some of the things that we're not ready for in terms of cases and in deaths. As far as getting personal protective equipment ready, hospital readiness, where are we in terms of those criteria that would allow us to move further into phase 2?
Okay, Supervisor Fletcher is going to respond.
So we just got the criteria around the same time that everyone else did, and so we're still assessing where we are in each of those categories. The reality is where we are in PPE or hospitalization or testing or tracing, in order to meet that threshold is honestly a little irrelevant because we're not going to meet the first threshold of 0 deaths. It's also a reality that no large county anywhere in California will meet that threshold either. And so that doesn't mean that we aren't doing everything we can to get PPE up and assess hospitalizations and look at testing and tracing and all of the other components. Those are all valuable things that we want to comply with in the interest of protecting public health. But the criteria as it stands now is not one that we meet presently, and it's not one that we predict we will meet any time in the foreseeable future. And so until such time as that criteria may change, we are going to be moving, consistent with what the state of California has outlined, the retail sections that were outlined today, and then they alluded to other sections that could be added in the coming days. And so we will do the analysis, we will do the assessment of where we are in relation to the rest of those, and we will continue to move to try and obviously meet every one of those. But the first couple ones there are the ones that are going to be a real challenge, not just for San Diego, but for everything, but some of the very small rural counties.
Thank you.
Okay, let's go to the next question.
Priya Schrader with NBC7. Please state your question.
Hi there. We're seeing reports that the San Diego Sheriff's Office is resuming evictions on properties that they had given notice to prior to the order that put a moratorium on evictions. Is it safe to resume eviction in a pandemic, and where are these people supposed to go?
Yeah, at this point, we don't have the sheriff here with us, so we would refer you to him. So we don't have an answer for you right now, but please contact the sheriff. Okay, next question.
Melanie Evans with the Wall Street Journal. Please state your question.
Good afternoon. Is the county undertaking any specific action in Chula Vista and surrounding communities where the hospitals are reporting rising numbers of cases?
Okay, Dr. Wooten is going to respond to that.
So I actually heard a comment. What is the specific question again?
I'm so sorry. The question is the county undertaking any specific action in Chula Vista and the surrounding communities where hospitals are reporting rising numbers of cases?
So thank you for that question. There actually are numerous activities going on. First, there's a task force that's being coordinated by the city that has close to 20 different organizations and agencies, including the County of San Diego, that daily looks at transfers across the border. It looks at cases that are identified by our Customs and Border Protection that might be COVID-19 related, but many of those cases at the border, individuals may not identify that they're coming across for treatment, but they are coming across in their cars and not being transported by ambulance. And then the third category is just looking at our census every day, not only for the entire county, but also in the South Bay area. So we look at those data every day. We are also cognizant of the fact that we are impacted by what's going on in Tijuana in general as it relates to COVID-19, and are sensitive of their needs there. In terms of, I know that they need everything that most jurisdictions need, but they specifically need PPE, healthcare workers, and we cannot provide them with PPE from our federal stockpile, but we are working with philanthropic organizations on the U.S. side to collect materials, money to send to support the TJ healthcare system across the border. And in terms of, as we are looking at expanding our testing, we are utilizing our heat map so we can identify what locations we need to stand up testing. So of the 3 permanent testing sites that we are standing up from state resources, Chula Vista area is one location where we have a permanent drive-through. And then we have our mobile van where we are identifying other locations, including locations in southeastern San Diego, and we will look at other locations as needed based on that heat map. Just remember that Chula Vista is very densely populated and it's geographic. So there are a lot of individuals that live in that area. And so you would expect to see that there will be a larger number of cases coming out from that area. But we are closely monitoring the cases and trying to deploy testing resources so that we can test individuals that are positive in that particular geographic area. Thank you.
Yeah, I might just add to Dr. Wooten's comments that kudos to the city of Chula Vista and the city of National City. They were the first ones to require everybody to wear facial coverings out in public. The county picked that up a couple of days later. And I want to again commend Supervisor Gaspar. She wrote a letter to the Vice President asking for some help in regards to the border situation, and we're waiting to get some response back from that. We actually think there may be some positive things that may be coming together in regards to that letter, so we'll report as soon as we know more. I believe we have one more question.
Paul with the Union Tribune, please state your question.
Hi, Paul Sisson with the UT. They wanted 15 contact tracers per 100,000 residents in the governor's press conference today. Do you feel like we'll be able to meet that threshold?
We'll have Supervisor Fletcher start first, and then maybe Dr. Wooten.
Yeah, thank you, Paul. No, we think that we will. We have a robust plan around testing, around tracing, around treatment. We think we will be there. Again, that threshold was only what was required if you were going to move beyond or more swiftly into stage 2 than what was outlined today. We are cleared with where we are to move into the retail, the manufacturing, the warehouse, the logistics consistent with that. If you want to move beyond that, but that is a good guide, and that is one we are going to work along with the other metrics into all of our planning, and we believe that we will get there. We're moving as rapidly as we can to onboard and hire and train and staff and build out all the systems, understanding that tracing, testing, and treatment is going to be a kind of foundational part of what we do until such time as we have a vaccine or therapeutic treatment.
Thank you.
And thank you for that question, Paul. I also just wanted to add that testing and tracing are very closely linked. So it's always great to have a metric to determine what the goal will be. But as we test more, we will need more contact tracers. And closely, or currently, as has already been reported, we have about 160 plus, 163 contact tracers and case investigators. So that is both case investigation and contact tracers. And as we continue to test, we will bring on more contact tracers. So that's driven by the number of positive tests. So I just wanted to make sure everyone understood the unique relationship between testing and contact tracing.
Dr. Wooten, I have a question from Saddam from Univision. Today, Chicano Federation Organization stated that we've seen an increasing number of infections in the Latino community, in part because of the structural inequities, and that the county needs to invest more in those communities to prevent them from being disproportionately impacted. Does the county have any comments on that statement?
Well, the statement that I made earlier about looking at where, number one, where our hot spots are, and also where there are no testing opportunities. And so we are doing all that we can do to ensure that we are putting permanent testing sites in the locations that need them, as well as having mobile vans, or that construct, and developing that strategy to go around and conduct testing. Say, for instance, this weekend we have testing in southeastern San Diego again. So we are comfortable with our strategies, and again, the southern region of our county is densely populated, and we have a large Latino population here in San Diego, so we would naturally expect that we would have a large number of our Latino population infected.
All right, thank you, Dr. Wooten.
This next question deals with the governor's announcement today that you'd have to go 14 days without a death in order to go to the next phase. And I believe Supervisor Fletcher will respond to the question if you go ahead and ask it.
Yes, it's from Mike McKinnon from KUSI News. At Governor Newsom's press conference today, one of the criteria he unveiled was no new coronavirus deaths in the past 14 days before moving into phase 2 of reopening businesses. Is that a requirement for the county too? And when is the estimated time frame of when we can accomplish that?
That is a requirement for counties that want to move beyond the sectors that we've outlined that we can move forward with. That is a requirement for all counties that want to move beyond that. That is not currently a criteria that we meet, nor is it likely a criteria that we will meet anytime in the near future. So we will continue to work with the governor's office in the state of California on their criteria. We will also continue to look out for additional sectors which they outlined today, additional sectors that they believe will be coming soon for the entire state of California. But for now, that's where we are, that's what we know, and so we are moving forward and opening those businesses that we are able to open.
And Supervisor Fletcher, this next one is related from Claudia with Univision. Hair salons, beauty salons are in phase 3 for reopening. Is there any update on a timeline for these businesses to reopen? Also, what are some of the public health rules that might apply to them for them to operate so they can best prepare for their reopening?
Well, the timeline for those to reopen are going to be set by the state of California, and so we would really have to refer you to the state in terms of what they anticipate, when they think we may be able to go into additional stages. It's unlikely they could predict a date, but again, we'd have to refer you to them, as that is their decision, and when we move into stage 3 as the state of California, along with the additional guidance. We've laid out our safe reopening plan for businesses that are opening now. As we get additional guidance on what criteria need to be in place for additional entities that are additionally allowed to open, we will certainly update our information and update and share that with all of you.
All right, thank you, Supervisor Fletcher.
This last question we have deals with contact tracing, and Dr. Wooten is going to respond.
And this one is from Taryn Mento from KPBS. Are the contact tracers logging where and how people believe they may have become infected? And if so, what has that information told you, or what do you hope it will tell you? It will tell you. And I have a follow-up question.
Thank you for that insightful question. In many cases, people may not know where they have become infected. However, if individuals are in sensitive occupations or from locations where we know there are other cases that would lead us to believe that there is an outbreak, then we take the appropriate procedures and process to investigate the outbreak situation. As you can tell, one of the locations where we have outbreaks is in our congregate care facilities, and we report that information to you daily, as well as any other community settings.
And she kind of elaborated a little bit. I've been told anecdotally from local doctors that many of the new cases that are likely linked to people who are either ignoring public health orders or linked to people who can't isolate because they are essential workers and may be exposed at work. So I'm wondering if you are collecting any of that data that may help determine if that is in fact the case.
Well, those people who can isolate would be those individuals that might be homeless, so we have resources to accommodate them. And then in some cases, individuals may not want to home isolate at their home because they might have vulnerable populations within their home. And again, we have our public health hotels would be a resource for those individuals as well.
All right, thank you, Dr. Wood.
Well, that concludes our questions for today, but before we go, as a number of us mentioned yesterday, yesterday was National Nurses Day, and actually we're in the middle now, or the first part of National Nurses Week, who we want to recognize because they truly are on the front line of the fight against this pandemic. But yesterday was also the day when we would normally hold a ceremony at the Law Enforcement Memorial at the County Administration Center to remember those law enforcement personnel in our region who gave their lives in the line of duty. I was very proud to have worked with former Supervisor Ron Roberts to create the Law Enforcement Memorial at the County Administration Center. And normally I, along with all the other members of the Board of Supervisors, would be at their annual event to pay our respects. But in this COVID-19 era that we're in, we couldn't stage a large gathering, but I can assure you I was there in spirit. Our law enforcement members have a very tough job, and that's even made tougher with this whole COVID-19 epidemic. So I just want to express that they have my unending respect and admiration for the work that they do, and I know that is also the sentiments of all my colleagues on the Board of Supervisors. Well, that's it for today. We'll see you tomorrow at 2:30, and please remember to stay in place, maintain space, and cover your face. Thank you.